Good afternoon, everybody. My name is Ruben Hernandez Leon. I am the director of the UCLA Center for Mexican Studies, and it is my distinct pleasure to welcome all of you to our event this afternoon. This is the last of the season and the last of a series of events focusing on the impact of the COVID-19 pandemic on Mexico. And I will introduce our speaker shortly, Christina Chica. But for now, I will begin with two acknowledgements that we read at the beginning of every event. The first acknowledgement is an acknowledgement of the native peoples of this region of Southern California. The Center for Mexican Studies at UCLA acknowledges the Gabrielino Tongva peoples as the traditional land caretakers of the Los Angeles Basin and Southern Channel Islands. As a land-grant institution, we pay our respects to the ancestors, the elders, our relatives and relations, past, present, and emerging. I will read now a press release, a statement of the International Institute supporting the movement for Black Lives and Black Lives Matter. The UCLA International Institute stands unequivocally against the egregious and disproportionate violence faced by Blacks in America and the systemic disenfranchisement and oppression of marginalized communities across the world. As the home of international studies on the UCLA campus, it is the Institute's mission to embolden people to connect through their shared humanity and think transnationally and across borders. Yet these past few weeks have humbled and reminded us of our duty to listen to our community so that we can learn how to be the ally that they deserve in the fight for justice, including against anti-Black racism. And now it is my distinct pleasure to introduce our speaker today, Christina Chica. Christina is a doctoral candidate in sociology at UCLA. She is a multi-method researcher who works in the areas of gender and sexuality, critical geography, and urban sociology. Today, Christina will be presenting preliminary results of her work in Mexico City and the strategies and adaptations of the LGBTQ+ community in Mexico City in the context of the COVID-19 pandemic. So Christina, welcome. Thank you for making yourself available in these very complex times, and the floor is yours. Thank you again.
Thank you, Ruben, for the invitation. All right. Hi, everyone. Thank you so much for coming to LGBT+ people's reported social and health adaptations to COVID-19 in Mexico City. Before I get started, I want to give a special thanks to my co-researcher, Ariceli Alfaro. I also want to thank Alonso Hernandez, Estefania Castañeda Perez, Fernando Villegas, Ignacio Lozano Verduzco, Joel Herrera, and Josefina Flores Morales, who were all key in helping to shape the survey and the process moving forward. So why did we create this survey? Essentially, it came from caring about two main research questions. The first being, how is the LGBT+ population of Mexico City spatially and technologically adapting to COVID? And then what we will be discussing more today is how is COVID-19 affecting the personal and social health outcomes, especially mental health outcomes of LGBT+ people in Mexico City. So this is also part of how they're staying socially connected, how this difference varies by demographic variables, and most importantly for this particular presentation, how that varies within the LGBT+ acronym of identities. So the survey instrument was put together by consulting a variety of materials, the Encuesta Nacional sobre Discriminación, which is a survey put out by a Mexican body that puts out other types of surveys, another survey that was put out by a LGBT group in Mexico City called Necesidades de la Población LGBTIQA durante la contingencia por COVID-19 and CDMX. And it was a needs assessment survey that complements actually pretty well what we were doing on a more academic level. And then another online survey that was put out on COVID-19 by scholars at El Colegio de la Frontera Norte. So you'll see on the right-hand side, we also consulted some best practices from the UCLA Williams Institute. We looked at the Mexican census, and then some other specific surveys. So for example, an HIV-related survey for the trans population in Mexico City. So just to be clear, these pictures on the right-hand side aren't an endorsement or partnerships. I just wanted to have a visual representation of some of the sources that we consulted with. So we put the survey together using Qualtrics. It's an online one-time self-reported volunteer survey. It was distributed through a snowball sample via individual and LGBT plus organizational networks, mostly through social media, online, email, and people were allowed to share with whoever they wanted to share with. And it was available all of May 2020. So we have our respondents who took it various times during, one time at various points in May. And it's 59 questions in total. It's in Spanish, which means that everything that you see here that's in question format or response format has been translated. And we also had a variety of question types. We had yes or no questions, multiple choice, fill-ins. There were some questions that appeared after you answered yes to something. We had some self-populating questions as well. And all of these questions were designed for both quantitative and qualitative analysis as a whole. But specifically for today's purposes, we'll have dummy and recoded variables that lend themselves better to quantitative analysis. Our questions delve into a couple of different themes, right? We have demographics, social networks, spatial behavior before and after COVID, LGBT plus specific connectivity before and after COVID, health strategies, disaster response, mental health and physical health before and after COVID-19. All of this is self-reported data. And then things that are in bold here are essentially what we're going to be spending the most focus on today. So a quick look at the sample overall. We have 367 unique participants with an 81% survey completion rate. You'll notice that the count on some of our tables is higher than 367, and that was only in instances where the questions allowed you to pick more than one answer, to which we were just looking more at the aggregate answers. Great. So before I delve in, I just want to state that these are preliminary results. Again, we're mostly going to be focusing on sample-wide responses, and there will be moments where we dive a little bit deeper into sexual orientation and gender. Then towards the end of the presentation, we'll get a little bit more specific with some of the tests that we have begun to run and what we plan to do moving forward. So you see this table here is a tab of sexual orientation and sexual behavior. We had a few different questions that were getting at similar types of themes, just to see how they would compare. From our chi-square test, you can see with the probability on the lower right-hand side, it's very much related, right? The relationship there is not independent, which means that most people who identified as lesbian, gay, bisexual, or somewhere in the plus category, which includes things like queer, pansexual, all of those identities, and then in terms of their sexual behavior, it corresponded pretty nicely, right? Great. If you take a look at our table on age, you'll see that it's pretty normally distributed. You'll notice that we have an overrepresentation of men in this sample, and most of the respondents are in the middle age category. Great. So speaking a little bit about education, occupation, and disability, on the left-hand side, you'll notice a word cloud with different work labels. Essentially, we put together that from the different options that we had. We allowed respondents to pick different types of career paths or sectors, right? And so you'll notice that whichever words are the largest proportionally, and that'll be true of every word cloud, are the ones that were the most likely to be picked. So you'll see entrepreneur, consultant, private sector, public sector activist, etc. This is just a sampling of the responses. And also something that's really interesting is that a fourth of the sample self-reported having at least some postgraduate education, which means that our sample is quite an educated population, especially considering Mexico's educated population overall is proportionally much smaller, right? And before I get into disability, another reason why that's important is to say this is an online distributed survey, which means that, of course, if you didn't have access to a computer or reliable internet or a phone, you weren't going to be able to take the survey, which could also account in some extent for the overrepresentation of educated people. So only 7.65% of the respondents for the question on disability reported having a disability. Here are some of the things that they mentioned: visual disabilities, right, HIV. What's really interesting about this fact is later on when we talk about at-risk conditions, right, you'll notice that the percentage of people who report having those is much, much, much higher. And so another reason why a variety of question types helps us get at really what's going on health-wise with our respondents. So a quick note on race. We asked 5 questions that were specifically geared towards getting a sort of racial and ethnic composition of our participants. The interesting note about this is that we followed census and other Mexican survey-specific norms of asking about whether or not you pertain to an indigenous population. More salient now is this idea of Afro descendants, right? But usually those also ask questions about skin color. And so we wanted to ask, what do you consider your racial and ethnic identity, with an open response, somewhat as an experiment to see what Mexicans were going to say, since sort of racial and ethnic salience operates in a very different way. We also asked, do you consider yourself indigenous or part of un grupo originario, right? Do you speak an indigenous language? If so, which indigenous language do you speak? And then, do you consider yourself Black, Afro-Mexican, or of Afro descent? There were very few people who did speak an indigenous language. Quechua was on there, so was Zapoteco, and there was a language that's affiliated with the region of San Luis Potosí. And so what's really interesting here is you'll notice that the biggest word is Latino. And that got us thinking, right? Because one of the things that we were wondering about is whether or not the prevalence of the term Latino was something that was selected, because remember, this was fill in your own, because the respondents knew that we were US researchers, or perhaps it was a racial ethnic category and concept that has really migrated to this part of the world and is being adopted. Less surprising was the second most prevalent, which was mestizo, mostly because the Mexican nation state, right, has this larger ideological project of thinking about all of its citizens as a combination of European and indigenous. And so it wasn't surprising that that was something that was on there. But then of course you have these other terms like moreno, even moreno claro, right, that were more sort of in reference to skin color. So I found that interesting. All right, so the respondents were allowed to take the survey if they were in CDMX, but also in the Estado de Mexico. The reason for that is because the boundaries are somewhat arbitrary, and we wanted to take into account that there were folks who might have lived in Estado de Mexico, but were operating fully in terms of their social lives, in terms of their jobs within Ciudad de Mexico. I think a good comparison would be to think of Los Angeles, how the actual boundaries of the city are a particular set, but of course there are parts of LA that even if they're not under those boundaries, we in our cultural and sort of more geographic imagination understand those to be Los Angeles. Not as surprisingly, we had 19% of respondents say that they lived in the municipality of Cuauhtémoc, which was inside Mexico City. And then we had the second highest being in Bonito Juárez, right? So Cuauhtémoc is the place that most LGBT nightlife actually occurs in. It also has most of those resources. Calle Amberes, which is considered the gay street of Mexico City, is also located here in this municipality, the Zona Rosa. And so it's interesting to see that. It's also important to note, I think, that it's a space that's undergoing a lot of gentrification. It's very international. There's changes that are going on. And if we have a more highly represented, highly educated represented population, it makes somewhat sense that we would have a lot of residents in these two municipalities where I would say somewhat more middle and upper middle class people live. And in terms of place of origin, most were born in Mexico City. We have 7.67 born in the Estado de Mexico, and then 27.95% came from other Mexican states. This is important to note, mostly because when we think about queer migration, right, internal migration into big cities, we can see that this probably is a trend that is applicable to Mexico City as well. And then 3.29% were from abroad. So we're going to dive into relationships a little bit. 64.84% of the respondents were single. And when I say single, I mean actually single, not just single legally in terms of divorce or separation. We allowed for a lot of relational types to be represented. Of those who are in a relationship, 9.07 are in monogamous relationships, 26.1% are in non-monogamous relationships. And we also wanted to get a little bit into our respondents' social networks. So we found that 19% of the respondents for this question, 19% of them had almost all non-LGBT friends. There was 18.4 that had almost exclusively LGBT friends. But of course, the majority of the sample, 63%, had a mix of friends in their social networks. And interesting tidbit, the lesbians in our sample were more likely to have only LGBT friends than the other sexual orientation categories. Cool. So a fourth identified as being dependents. You'll notice here that proportionally speaking, you're less likely to have been a dependent if you were a cis man, right? Probably for lots of reasons that have to do with economic positionings and whether or not they have access to certain kinds of resources, right? But then when we flip that over, in terms of thinking about dependents and children, right, we notice that only about 10% of the sample of respondents have children. And 8% of those 10% have only about 1 or 2 kids. However, 30% have dependents, right? And so what that means is that while not very many people have children, plenty of people do have someone, perhaps a family member, perhaps a partner, who are financially or dependent on them in some sort of way. And you see that when you look at the gay category and you look from kids to dependents, right, it rises significantly afterwards. So there's quite a few people who identify as gay in this sample who are financially supporting others. Great, so we're going to talk a little bit about housing. 12.67% of the sample stated they had changed their housing situation during the pandemic. Of those, 2/3 moved to another place directly due to COVID-related reasons. So they were moving and shifting, perhaps because they lost a job, perhaps because they had to move in with somebody else, or their situation wasn't safe for them. And from the time of the survey, half of the participants spent between 26 and 50 days in quarantine, with a mean of 38 days. So keeping in mind that participants answered some point in May, so by that point they might have been in quarantine for a couple of weeks, perhaps a couple of months. And 84.25% of participants are living with other humans. I say that because some also noted that they were living with their pets. So who are they living with, right? You'll notice from the table that we have a combination of family, significant other, friends, kids, pets, acquaintances. The multiple category says that they're at least living with 2 or more of the above categories. So there's 36.26% that are exclusively living with family members, but then the next highest are the multiple, which means that they're living with a combination of significant others, friends, with their kids, with their pets, and then who are completely by themselves without any pets. You see that that gets closer to 10% of the sample. All right, now we're going to dive a little bit into health effects. So we had multiple questions that dealt with feelings and sensations that respondents were feeling or going through during this time, and we grouped them into negative and positive emotions. You'll notice that 86.72% were feeling a combination of negative emotions, right? But there's also some people for whom the pandemic has actually been helpful, right? Perhaps because they have more time at home. There's a lot of reasons that that could be. So you'll notice here from this word cloud that we have all of the different options and sensations, some of which respondents were allowed to write in, placed together. The most common feeling was just stress. Feeling stressed, feeling restless, feeling insecure, afraid. But then, like I said, there are some participants who feel more relaxed, they feel more stable, more calm, but overall, the pandemic and all of its consequences are creating a lot of negative health effects, mentally speaking. Okay, so to speak directly to sleep outcomes, 10% of the respondents reported extraordinary dreams. 1/3 of them are sleeping more than usual, but 57% are sleeping less than usual. So what's keeping people up at night? Well, it could be some of these issues that we have on this table, right? COVID-19 related concerns, which talk about health concerns, talk about interpersonal conflict, losing work, catching COVID. What's interesting here is you'll notice that the highest cumulative percentage in terms of selections was the economy and the state of the country, right? So really what's keeping people up at night is how Mexico is going through this. I mean, I can say that the peso depreciated already significantly, and economic situations are really what people are concerned with, then followed by loved ones catching COVID-19, among other types of concerns that you can see here. All right. So 56% of the respondents to this question self-reported at least one of the following conditions, right? So these conditions were picked in terms of their high risk potential for having complications or death if you were to catch COVID-19. So you see we have obesity, HIV, cardiovascular disease and issues. And so I want to say that this 56% is quite noticeable and significant, just for the fact that these sorts of questions tend to receive underreporting. And so the fact that that many people were able to say, yes, I have these sorts of conditions and they're concerning for me, shows just how much this sample population have these health concerns, right? And like I said, since we are representing mostly cis and gay men, the fact that HIV is large on this word cloud is also not surprising. But what's also interesting to note is that although everyone, for the most part, has been quarantining for different amounts of time, no one has actually stayed home, right? There are very few people who have actually stayed home. Everyone has had to leave for one reason or another, mostly to buy food and errands, as you see with the bold at 45.79%, right? And then you can see other reasons like visiting family, recreation, walking your dog, going to school, work. And I just wanted to point out that even though our participants mostly said that they were quarantining, you still have these instances of leaving and visiting members of other households, right? And so these sort of competing understandings of what constitutes being separated and not separated and leaving your home. So now we're going to get a little bit into finding information related to COVID-19. You'll see here these two-way tables with chi-square computed, and specifically looking at a tabulation of the frequency that one looks for information and COVID-related developments by LGBT+ status, so sexual orientation, and then gender and sex. So here looking not at gender identity, but looking at cis men, cis women, and all folks under the trans umbrella were aggregated together, right? So what you'll notice is that the p-values for both are less than 0.05 and thus are statistically significant. It doesn't tell us which grouping specifically this applies to, but we can note that gender and sex, sexual orientation, when compared to the frequency of news, are not independent of each other, right? There's a statistically significant relationship between them. I also just want to point out really quickly that while most people in both of these categories, right, were checking the news daily, gay respondents who identified as gay, right, or respondents who are cis men were more likely to check various times a day. So they're actually cycling through the news more often. Where were they getting their COVID-related developments and information from? Well, there's a combination of sources that we have here in this table. And you'll notice things like international sources, academic scientific articles, right? Looking at social media. And actually the most popular place to go and get your information about COVID developments was social media, right? And then if you add that to the YouTube category, it's even more, right? Which means people are going on these websites, perhaps looking at articles that friends have shared or experiences that they have shared online, and that's where they're getting their information. But second up, which I find interesting, is specifically communications from Lopez Gatell, who is the Undersecretary of Prevention and Health Promotion here in Mexico, and has been really the face in a lot of outward news reporting about what's going on in terms of Mexico city developments, Mexico more broadly in terms of COVID. Okay, so now we're going to get a little bit into COVID-19 cases within respondents' social networks. 39.37% of respondents said that they knew someone who had taken a COVID-19 test. I think that this is a really big deal because it's actually quite difficult to get your hands on these tests unless you are severely demonstrating symptoms or already in the hospital, or you do what I did and I muscled my way and made someone give me a COVID test. But the other thing to note is that 28.66% of respondents to this question said they knew someone who had been hospitalized in the last 5 months with COVID-19 or quote unquote atypical pneumonia. The reason we decided to put that in the question is because there's a somewhat, I think, politically motivated reason to label certain cases as atypical pneumonia. It's been on the news, it's been in different kinds of discussions about how when marginalized populations or poor populations are sick and dying at disproportionate rates for what we call this atypical pneumonia, it's a way of being able to label it without calling it COVID. And most of that has to do with the fact that those COVID tests are not being made easily available, they're not being taken sufficiently, so it's difficult to know, but it's also a sort of coded way of knowing that there's a great likelihood those cases could have been COVID related. And I just want to put it out there, the official reports in Mexico mark the mortality at 12%, right? So what happened to these folks who were in the hospital or they knew people who had been hospitalized with COVID? Well, as you can see here, it wasn't that great, right? So out of the 88 instances, 42.05% died, right? Which means by the time they got to the hospital, the condition was so severe and there weren't perhaps enough resources that they died. But then we also have 30.68% of people whom are improving. There's a good percentage of people who just didn't know what happened to the folks after they were admitted to the hospital. But I think it's interesting to note that quite a few people in this sample, right, know someone who has been deeply affected by this and a lot of people who have passed away. Right, so getting into some health strategies, we're going to look at our question 34 from the survey. What measures have you taken to avoid the spread of COVID-19? So we had a combination of measures that respondents were able to pick, those that applied. The ones that stand out the most, that most respondents are clicking on or participating with in some way, is using a mask, right, or covering their coughs and sneezes. And you can see these other protective measures like staying home, washing your hands, measures that have been promoted through the news, through sort of health media sites and professionals and scientists, right? So most people are trying to take these measures and those are the ones that are most common. And then question 20, by what method do you stay connected with your friends during COVID-19? We specifically asked this for mental health reasons, right? To think about how it's important for your health to be socially close even if you're physically distant. And we have this rise in video calls and virtual spaces, right? That's mostly what people are doing. They're using these technological solutions and medium from which to connect with each other, right? And so virtual spaces are a combination of social media, workshops, right? I mean, right now we're on a Zoom call, and that's how people are connecting with each other. Some organizations here that I have been following have also moved quite a few of their activities to online and virtual spaces. So that's important to note. And now we're going to dive a little bit deeper in terms of our statistical analysis. Question 30 and 35 was asking about participants' mental and physical health behavior before and after the start of COVID-19, whatever they self-reported, right? And so here we have a pairwise correlation of these different kinds of behaviors, right? These self-reported health habits before and after the start of COVID-19. So essentially what's important to note here is that we're looking at behaviors like exercise, mindfulness, eating healthy, therapy, meds, and we're looking at the relationships between practicing those and practicing other healthy habits, as well as the relationship between doing it prior to the start of COVID-19 and after the start of 19, right? So this table of correlations between various health habits pre-COVID and after the start of COVID indicate the correlation between two variables are statistically significant regarding their relationship to one another. And you'll notice that the blue highlight is doing pre to pre, right? The yellow is looking after start of COVID to before COVID, and then the orange is looking at after behaviors to other behaviors. So basically, and to say this shows that it's the significance level at 0.05. So it's related here. But digging a little bit deeper at a couple of the behaviors, so one of them being therapy or medication by gender and sex, right? Here the reference group is cis men, and this is sorry, this is a linear probability model, right? And essentially what we're demonstrating here, if you look at the highlighted point, right, is that in comparison to cis men, only trans folks showed a statistically significant relationship with a negative correlation of 25% regarding their engagement in therapy pre and post COVID. So that was really the difference, that they were less likely to engage in meds and taking medication or engaging in therapy. And just anecdotally, to add some context to that, I have been part of different conversations and information spreading where trans folks were talking about the difficulty of receiving care and that type of discrimination, how they've not been able to have as much access to specific gender affirmation medication and other types of services. And, you know, I wonder out loud if that has anything to do with that difference there. And then specifically looking at exercise by gender, sex, with the reference group being cis women. Again, we noticed that only trans folks showed a statistically significant relationship, right, with a negative correlation of 30% regarding their engagement in exercise compared to cis women. And so this is just an example of how we're diving a little bit deeper into the variables, right, and different types of relationships and the strategies that we're going to be using moving forward to compare other types of variables and other types of behaviors by demographic identities, right, or by sexual orientation. Great. So I'd be happy to answer any questions that anyone has, and I can, you know, talk more about what I presented in the presentation. But I also have questions for the audience. If anyone would like to give some suggestions for how we can think about the relationship between certain variables, or how we can move forward with doing our comparisons, whether it's quantitatively or qualitatively, I'm happy to hear any type of suggestions that anyone has or advice for moving forward with analyzing our survey results, because these are preliminary results. And thank you very much.
Thank you. Thank you, Christina. Thank you very much for your presentation. Very, very interesting, highlighting the impact of COVID-19 on this LGBTQ plus community, as well as you know, the larger impacts of COVID-19. I think in Mexico City in particular, because of the relationships that folks have with the community in general, and how you know, they are responding to these extraordinary public health emergency. So now we invite actually our audience to use the Q&A function for those who are connected via Zoom, and ask or pose some questions to Christina. As she mentioned, she is also taking suggestions on, you know, potential directions for the analysis of this survey. I mean, these are, as she just said, these are, you know, early preliminary results. There's much that lies ahead in terms of the analysis of a survey that is, you know, particularly rich in terms of the many different things that you guys asked your respondents, and the kinds of comparisons that you actually can make with different populations as well. So if you have any questions, you can use the Q&A function. Let me see, there we have Alonso Hernandez is asking in Spanish, ¿a qué crees que se deba más respuesta de hombres cis gay a la encuesta que a otras identidades?
Should I go ahead?
You can go ahead, absolutely.
So I think it's a combination of sampling, right? So in terms of who distributed the survey, which networks it was able to get to. I think that I was connected to these organizations and individuals whom perhaps most of the people who are interested or part of those networks were men. I also want to say that there was a survey that was more of a needs assessment, but was released by an organization called Musas, right? And the reason I mentioned that is because there were a couple of questions that tied in really nicely, and I actually am in communication with them. I'd love to, you know, cite their work to talk even more about the power of our survey. And they actually had overrepresentation of women, right? And so I think what that was a combination perhaps of the networks in terms of the survey circulating, but also maybe perhaps survey fatigue, right? I mean, by the time that ours was released, some of these networks overlap. Perhaps these women were more interested in taking a survey where they were specifically asked to talk about the issues they're having that was going to be addressed by a civil society organization, as opposed to what we were doing, which was, mostly purely for academic reasons, right? So that could have been part of it.
Thank you, Christina. I don't know if there are any other questions. Ignacio Alonso Verduzco. Alonso's question is very relevant. All surveys cater to LGBTIQ groups have an overrepresentation of cis gay men. So it's kind of like delving into this particular issue of representation of a particular group. At least in Mexico, Ignacio says. So yeah, I mean, this appears something that was faced by different, by folks doing these kinds of inquiries, these kinds of exercises, right?
Right.
So, yeah.
I mean, I do have another comment on that, which is essentially, it's the same reason why any type of researcher has issues with hard to reach populations, right?
Mm-hmm.
I mean, essentially it's what is it in it for them, right? Most women, most trans folks, they might not want to be participating in certain types of, I guess, studies or certain types of insights into their lives if there's not a clear incentive there, right? I mean, it might be something that, we needed to work on in terms of like resources, right? And I would have loved to be able to just give every participant a certain amount. And like I said, perhaps more of that part of the population would have been likely to respond to other types of inquiries that were going to directly benefit them in a particular way than perhaps something like this, right? So it's always complicated, but
Very good. Alison Ramirez is asking, how was respondents' socioeconomic status during COVID? Or how did, if I understand correctly, how was the respondents' socioeconomic status impacted, or how did it impact their methods of self-care during COVID?
Yeah, that's a great question. So we asked about occupation, we asked about education, but we didn't have a question that directly told them to tell us how much money they make and had. Part of that had to do with just trying to make this survey very specific to a Mexican audience, right? And so those kinds of questions aren't asked as much in the types of surveys that I was consulting with that were given to Mexican audiences, which is one of the reasons why I thought that it would be an interesting experience to ask this population about race and ethnicity. But of course, like I said, it is a highly educated population. Most of them live in the municipality of Guatemala and Benito Juarez, of which a lot of the housing stock here is more expensive. I'm currently in the municipality of Benito Juarez, so I assume that some of them do have means, but it's also hard to say, right? I mean, I think it was really interesting to see that trans folks were engaging in less exercise, right, in comparison to the reference groups, were not engaging in therapy or taking as much medication as the other reference groups. I'm sure if we play with the variables more, we'll see some of those sorts of things. And why would that be, right? Well, trans folks are the most marginalized part of our larger population, right? And so, I mean, there was, I would have loved to be able to reach even more people. I mean, there was a respondent who had said that they were a sex worker. And of course, has been really difficult here for folks in the city, right? In terms of the closures of hotels and areas of work, finding housing. And, I think another thing to keep in mind is this population in some ways is probably not sort of as affected by the economic situation, but they are most concerned with that, right? And like I said, a great, almost a third of them have dependents, right? And so, I mean, I think that that's something that we need to keep in mind is, even if you don't have partners, right, officially, because most of the sample is single, even if you don't have children, right, they're still part of these interconnected networks of support. And so, there's obviously some movement happening there. But of course, it's difficult for me to say, right, because I didn't straight up ask, how much money do you make in a year? And that in itself, I think in Mexico is really complicated because the way that income works, the informal economy is so strong. Even if you do have a formal position, a lot of people have side hustles and jobs, and maybe someone lives in a parent's property that they own, but they don't have any income, right? And so it's kind of difficult to measure resources in that way.
Jacob Thomas is asking, since many survey participants, or it's actually more of a comment and suggestion, since many survey participants mention economic precarity and unemployment as a source of stress, I think you may want to interact it with both relational data on who they are most physically proximal to or living with. One hypothesis is that a fall in financial independence may be moderating the relationship between familial relations and emotional well-being, particularly for those that have had to move in back with parents that are heteronormative or utterly intolerant to LGBTQIA lifestyles.
Thank you, Jacob, for that suggestion. I guess I'll mention here that we actually did ask respondents if the people that they were living with in their housing situations knew about their gender identity and sexual orientation, right? So most people were out. Then we asked what the reaction to that was, if it was rejection, indifference, if it was acceptance, and most of it was either acceptance or indifference. And so there's definitely some respondents who are living in a housing situation that is not ideal, that is violent for them, but at least in terms of this particular sample, it seems like most people are in housing situations with people who are, I mean, I guess mostly fine, right? Not outright hostile.
Thank you. We have a comment from Rafael Solis in Chicago. Mine is a commentary, not a question. It was interesting to me how people were identifying as Latino, quote unquote.
Right.
I have not lived in Mexico for 24 years, but it sounds to me strange as a new way of defining ourselves. Something I have noticed in the past few years is the popularity of the so-called hookup applications in Mexico. In those, the options to identify one's race are the ones available here in the USA. They are not customized for other countries. I've always found interesting that Mexican gay men chose to define themselves as Latinos. In these apps, most times it is optional to identify your race.
I mean, yes, it is really interesting. I mean, that's why we put that question on there. And I have to wonder whether or not it was because they knew that we were US researchers asking this question, or if it has to do with terminology and language molding. Something that we didn't get into in this survey, but I hope to talk more about in future work, is how language has been shifting and evolving in the LGBTQ+ community here in Mexico City, in terms of using the X for gender neutral, some people using the E, and really taking on words like non-binary and genderqueer, which I would not expect, right, in this kind of context, or other types of terms like queer that really don't translate very well, but some people are taking it up. I think that has a lot to do with just transnational networks, you know, education, who you're connecting with and everything. So I agree that it was interesting. It was strange for me, and you know, it would have been great to disentangle that a little bit more. But in general, I'm seeing interesting movements and shifts with language more broadly with sexually diverse and gender diverse populations in Mexico.
Thank you. Oscar Contreras is commenting and asking, some sources point out that domestic violence has raised in households in Mexico during these COVID times. Do you find similar situations in your study?
So we didn't ask a question that specifically asked about domestic violence. I mean, we had instances where, you know, we could talk about whether or not they felt safe. So towards the end of the survey, we asked them where, if you were taking the survey in a safe location, in private, in public, or among people that you had trust with. We also had an open-ended question where people could leave commentary, which is going to be fascinating for the qualitative analysis, because we have a lot of commentary about the political, social inequalities and, you know, how disasters just make that more clear. And I think I'm gonna have a lot of fun sort of working with that, but nowhere in the places where someone could have made a comment about it did I see that. I think there was like maybe one person who mentioned something about violence, maybe there was two, but it wasn't very prevalent. Again, however, I should say, I mean, we oversample, right, men in this situation, right? And so, you know, there are other surveys, for example, I know that UNAM put something out specifically for women. And I know that in that question, there was maybe something asking about sexual orientation. And of course, when they come out with those results, which I hope to also be able to, I guess, consult as I'm moving forward with writing and everything, that they'll probably have like a better look at that, right? And hopefully, if they're asking about bisexuality or asking if respondents identify as lesbian, hopefully we'll be able to get more sort of information from that effort.
Excellent. Andrea Rocha in San Diego is asking, what was the incentive for people taking the survey, and how will results be returned to participants of the survey?
Right, so in the consent page, right, so the first thing that came before you entered it, we said that this was voluntary, it was going to be for research purposes. We also did say that for every survey that was completed, right, 100% completed, we were going to commit, my partner and I, to donating $1, which we did, actually. We ended up donating $300, particularly to Casa de las Muñecas, which is a trans-specific organization here in CDMX that is housing trans women, most of whom are sex workers, and also going out into the streets and feeding them. So, you know, I mean, there wasn't a direct benefit, but there was a social incentive. And there are a couple people who are on this call who are related to these sorts of organizations. I hope to present these results actually in Spanish, right, to different, within different groups in Mexico City who would benefit from knowing about it, right? And I'm open and in communication with other folks who are trying to think about these results in a more sort of policy-oriented way. For example, I know that MUSAS has been in communication with a government body here in Mexico City to see if we can actually expand this survey on a national scale. I have no idea if it'll happen. That would be super cool if it did, so that then we can address needs more. I mean, we can address needs better in that kind of way, right? But so of course I'm looking for ways to put this out there, to be in communication with folks. Like I said, we did put our money where our mouth was. And I hope that I can be part of other efforts, local efforts, to expand these survey efforts and to really capture what's going on for the larger sexually diverse and gender diverse community.
Thank you, Christina. I don't see any more questions in our Q&A feed right now, but I continue to encourage our audience to post questions or comments to Christina. There's might be another one. Hold on one second. Yes, Jacob Thomas again is asking or commenting, I think you could also obtain more qualitative data about how diet, exercise, and health and self-care has dropped off for trans participants after COVID, since you would expect a priori the correlations between the pre and post pair variables to be closer near to 1. I also wonder if you would be able to deduce what is different about LGBTQIA experience with COVID compared to Mexicans by appending your data to reliable general surveys of general Mexicans' responses to how they adapted to COVID. Yeah, so this goes to the whole issue of comparing, of course, you know, responses of this population to other populations in Mexico, of course.
Right, thank you, Jacob. That really just depends on what I have access to. Like I said, my eyes are open in terms of the COVID survey that was put out by the Colegio de la Frontera Norte, right? That was more general. I mean, the institution in Mexico City, UNAM, who put a women-specific national survey. And so really, I'm gonna be keeping my eyes open. I also have results from the survey that MUSAS put out, right, the needs assessment, and they had a similar sample size to ours, right? And so I think it pairs nicely in terms of ours was more representative of men, theirs was more representative of women. And so, yeah, moving forward, I'll keep my eyes open to see how I can compare this moving forward. But it also just really depends on how much information, right, these bodies, these research bodies want to share with me, right? I can have access to a paper or report, but are they going to give me, you know, raw data? It really just depends.
Thank you, Christina. So I actually, let me use my prerogative as a moderator also to ask a question. What are you, and this is related to the survey, but not directly. What are you hearing in terms of, how people's behaviors or in situations in general are changing as Mexico and Mexico City begin to reopen or have started to reopen. Some people are going back to work. There is reopening or discussion at least about reopening of certain spaces for leisure, for sociability. But at the same time, contagion as well as death rates continue to be very high. We know that Mexico City is essentially the epicenter of the COVID-19 pandemic in Mexico. So what do you hear in relation to how people are sort of navigating this transition or semi-transition to some aspect or normality, or nueva normalidad, as they call it in Mexico?
See, I have been, how do I say, a part of different conversations, right, within the community, within different organizations that are specifically talking about the new normal, right? And it really just depends on what you're asking about. So I'll give a couple of reflections on a couple of things that are, I think, sexual orientation and gender identity specific. So, Pride for Mexico this year, right, the parade, the events were done virtually. And apparently it was like the largest virtual Pride events that were done were that weekend, but there were still some folks who went out to protest on the street, specifically because they were concerned about violence issues, they were concerned about discrimination, health access, right? None of these things sleep just because we're at home, right? And Mexico has been having quite a few issues with domestic violence and other sorts of things. And so, but there were only around 200 people who went out to the streets to do that. And so what that tells me is that a lot of folks are still staying in, because actually Mexico City began opening little by little. First of all, they never really fully closed, I can tell you that. But then they really started opening more towards the beginning of June. And then by the end of June, you still didn't have enough buy-in from the community, right, to actually be put their bodies on the streets, right, in one of the largest prides, right, in the world, right? And so that's happening. There have been different conversations about intimacy, also specifically, how are you going to have sex during this? And some folks are saying, well, you're not. I mean, you're going to do it with the person who's at your house, but you can't go out and cruise anymore. Other folks are going to say, that's not realistic. That's not going to happen. What are we going to do? I know specifically that there are folks in the community who are just not going to leave. They're just not leaving. They're posting commentary or memes about how folks are finally ready to party or do this, and they're just like, nope, goodbye. I'm here. I'm staying in here. And of course, this could have something to do, especially with this particular sample, of high prevalence of at-risk conditions, right? I mean, they're not going to do well. I mean, Mexico City medical personnel has also been protesting. I've witnessed a couple of those because they don't have the right type of gear to actually be handling people. I should note that a majority of my sample noted that where they usually get medical care is actually from the pharmacies, right? And the private consultories there. And so, what are they going to go do at a hospital? I mean, there's just so many things to keep in mind in here. And also, as far as I know, the bars, the social spaces are going to be the last things to open. I mean, maybe it won't happen that way, but as far as I know, those spaces won't be opening until much later. But I also think that it's hard to predict because, the Mexican government, especially with Mexico City, has been very, somewhat nonchalant about certain kinds of measures. And sometimes they'll do something and then they'll take a few steps back and they'll say, just kidding. So it's really hard for me to predict what's going to happen. I think that what I've been hearing from a lot of conversation is that these virtual spaces will continue, right? And a lot of these organizations are going to continue to adapt, to do virtual outreach, to do virtual workshops. I know different organizations that are very presence-based, right, that have decided to move all of their, talleres, their workshops, and their conversations to an online format. But it seems like there's going to be a lot of hybrid spaces, right? But yeah, I mean, I don't know. It's gonna be rough. I'll see what I return to for my in-person observations and where I can make them.
Of course. Well, we don't have any more questions in our Q&A feed here. So, and we're close to actually to the end of our allotted time. So I want to take this opportunity to thank you, Christina, for participating in our speaker series, and wish you the best of luck with the project, and to extend the an invitation, an open invitation for you to come back to the events of the center to present more of the results of this very interesting survey. I want to thank Brian Pitts, who's the Assistant Director of the UCLA Latin American Institute, who has been who has played a key role in organizing a lot of our virtual events since the onset of the pandemic. And we are going to be pausing some of these events for now, but we'll come back soon. Stay tuned. And I wish everybody a happy summer, and above all, for all of you to stay safe and healthy. Thank you, everybody.